Welcome to the deep dive.
Yeah.
Today we're going to be looking at something that's, thankfully, pretty rare,
Yeah.
but can be, incredibly serious when it happens to cats.
Yeah, for sure.
Traumatic atlantoaxial hyperflexion.
A traumatic atlantoaxial hyperflexion.
Yeah. So
It's a mouthful.
it is a mouthful.
But basically, we're talking about whiplash.
Oh,
In cats,
okay.
it affects the very top of their spine, that delicate little area where the head and neck connect.
Ouch.
Yeah.
So what exactly happens in this kind of injury?
So you've got the atlas and the axis.
Mm-hmm.
Those are the first two vertebrae in the neck, and they're responsible for,
Right.
all that amazing head movement that cats have.
Yeah.
But when there's sudden, forceful hyperflexion,
Yeah.
like you might see in a car accident or a bad fall,
Oh.
those vertebrae can be seriously damaged.
And we're diving deep into a study today that followed 8 cats
Yeah.
who experienced this kind of trauma.
Yep.
What can you tell us about these cases?
So the study looked at 8 cats suspected to have this atlantoaxial hyperflexion.
Mm-hmm.
And there was kind of a pattern here.
Oh, really?
Yeah, 7 out of 8 were young male domestic shorthairs.
Oh, so young, adventurous males.
Yeah.
Always getting into something.
That's right. They're much more likely to be, out exploring, taking risks.
Right.
Unfortunately, that can sometimes lead to accidents.
So speaking of accidents,
Yeah.
how did these cats end up with such serious injuries?
So road traffic accidents, sadly, were the most common culprit.
Yeah, that makes sense.
But there were a couple cases of head trauma from other causes as well.
The study mentioned one cat ran into a pole while being chased by a dog.
Oh, gosh.
Can you imagine?
Scary.
Another one slammed into a door,
Oh,
and one even experienced forelimb collapse in a kennel after a dental procedure.
yeah. It just goes to show how
Wow.
quickly things can go wrong,
God.
even in seemingly safe environments.
Yeah.
So when these cats arrived at the vet hospital, they were showing some pretty alarming neurological signs.
Yeah, that makes sense. Given where the injury is, what kind of symptoms were they experiencing?
So all of them showed signs of what we call peracute non-progressive myelopathy.
Okay.
And essentially, this means their spinal cords were affected very suddenly and severely.
Right.
But it's interesting.
Uh-oh.
The study emphasizes that these neurological signs were non-painful
Okay.
and mostly symmetrical.
So affecting both sides of the body equally.
Yeah, pretty much.
Okay. But in terms of how it affected their movement, were they able to walk at all?
So most of them were either tetraplegic,
Okay.
meaning complete paralysis in all 4 limbs,
Oh, wow.
or non-ambulatory tetraparetic,
Okay.
meaning they had weakness in all 4 limbs and couldn't walk.
So basically they were paralyzed.
Yeah.
Wow, that's incredibly serious.
Yeah.
I imagine diagnosing something like this requires some pretty high-tech equipment.
Absolutely. To really understand what's going on, these cats needed MRIs.
Right. Magnetic resonance imaging.
Exactly.
That allows the vets to see the damage to the spinal cord in detail.
Uh-huh.
So what did the MRIs actually show?
Well, in all 8 cats, the MRI revealed a single distinct lesion
Okay.
right at the point where the dens sits.
And the dens is...
Oh, that's that bony projection from the second vertebra, the axis.
Right, okay, so they all had lesions in the same spot,
Yeah.
but were the lesions all the same?
So that's where things get interesting.
Oh.
Some of the lesions appeared bright on the T2-weighted MRI images,
Okay.
which suggests edema or swelling,
Mm-hmm.
but others were darker, possibly indicating hemorrhage.
Oh, so bleeding.
Yeah.
So even though they all had lesions in the same spot, the appearance of those lesions
Yeah.
could vary quite a bit.
Exactly. And that just shows how complex these injuries can be. And
Yeah.
it's not always a straightforward case of a clean break or, simple compression.
Right.
There can be a whole cascade of damage happening within the spinal cord.
And this is where things start to get really interesting, right? Because that variability in the lesions must make diagnosis and treatment even more challenging.
We got it. And the study authors point out that the damage often extends beyond the spinal cord itself.
You mean there were other injuries besides the spinal cord lesion?
Yeah. So several cats had additional complications like fluid buildup in the joints between the skull and the first 2 vertebrae,
Wow.
ruptured ligaments in their necks, and even fractured dens.
Oh my gosh, that paints a pretty vivid picture of the force involved.
It really does.
In these accidents, it's amazing how much those tiny vertebrae can withstand.
It really underscores the importance of a thorough examination and imaging,
Right.
to assess the full extent of the trauma, because if you miss those secondary injuries,
Yeah.
you might not be giving the cat the best possible chance of recovery.
So what happened to these cats after they were diagnosed? Did they all need surgery?
So in these particular cases, all the cats received medical management.
Meaning they didn't have surgery.
That's right, no surgery.
Wow, so how do you treat something like this without surgery? And more importantly, what were the outcomes?
Those are great questions.
Yeah.
And we'll delve into the specifics of the treatment they received and how they fared in part 2 of our deep dive.
Stay tuned.
Yeah.
Welcome back to our deep dive into feline traumatic atlantoaxial hyperflexion.
Yeah.
Last time we were talking about those really scary neurological signs that these cats were experiencing.
Right.
And the fact that MRIs played a huge role in diagnosis.
Mm-hmm.
So what happened next?
Well, you might be surprised to hear that despite the severity of these spinal cord injuries, none of the cats in the study actually underwent surgery.
Really? No surgery?
Nope.
That's amazing. But how do you even treat something like this without surgery?
So that's where medical management comes in.
Okay.
It focuses on managing the symptoms and supporting the body's natural healing process.
So what does that look like in practice?
Well, typically it involved strict cage rest to immobilize the neck and prevent further injury.
Right. You didn't want to move it around and making things worse.
Exactly. Pain medication was also essential to keep the cats comfortable.
Yeah.
And in some cases, anti-inflammatory medications were used to help reduce swelling and inflammation around the spinal cord.
I can see how all those elements would be important for giving the body a chance to heal.
Right.
But is there anything else that can be done to help these cats regain mobility?
Absolutely. The study authors emphasized that early and aggressive physical therapy was key.
Oh, wow. Physical therapy for cats.
Yeah.
That's fascinating. Tell me more about that.
So it's based on the understanding that movement and rehabilitation are crucial for stimulating nerve regeneration and helping to regain mobility.
So what does physical therapy for a cat with this type of injury actually look like?
Well, it can involve a range of techniques from like gentle, passive range of motion exercises where the therapist actually moves the cat's limbs for them.
Oh, wow.
To assisted walk-in where the cat is supported as they try to take steps.
That must take a lot of patience and skill on the part of the therapist.
It definitely does.
Yeah.
The goal is to very gradually reintroduce movement and help the cat regain strength and coordination.
So how long does this process take?
Well, it varies from cat to cat, but the study highlights just how resilient cats can be.
So tell me, how did these cats recover after going through all this intensive treatment?
Okay, so the results were actually pretty remarkable.
Okay.
2 of the cats in the study achieved complete recovery.
Oh,
like they returned to their normal, active selves.
that is amazing news.
Right.
I bet their owners were over the moon. What about the other cats?
So 4 of the remaining cats showed significant improvement.
Good.
They regained some mobility and independence. 1 cat remained stable, but didn't show further improvement. And sadly, 1 cat had to be euthanized due to a lack of improvement and persistent neurological issues.
It's heartwarming to hear that so many of the cats had positive outcomes after such serious injuries. But the fact that 1 didn't make it is a real reminder of the seriousness of these cases. What do you think contributed to the successful recoveries?
It's hard to say for sure because each cat is unique, but the study authors really stress the importance of early intervention.
Right.
The sooner you can identify the injury and understand its nature, the better equipped you are to tailor treatment and manage expectations.
And that brings us to one of the most intriguing cases in the study.
Yes.
The cat who sadly had to be euthanized.
Right.
This was the cat whose spinal cord lesion had become fibrotic.
Exactly.
Right.
During the post-mortem examination, they discovered that his spinal cord lesion wasn't just damaged, it was full of scar tissue.
Oh, wow.
And this fibrosis can develop incredibly quickly after a spinal cord injury.
So even though the initial injury might have been caused by the trauma, the long-term consequences were really influenced by this fibrotic process.
Exactly. And this just highlights the importance of those sophisticated imaging techniques.
Right.
Like MRI and CT scans. They're essential for accurately assessing the full extent of the damage and identifying potential complications like fibrosis.
It makes you wonder if earlier and even more aggressive treatment could have made a difference for that cat.
It's a really thought-provoking question, and it's cases like this that really drive veterinary research forward.
Right.
Always searching for better ways to diagnose, treat, and ultimately prevent these devastating injuries.
So what can we learn from all these cases?
Well, I think the biggest takeaway is the importance of early recognition and intervention. If you see your cat suddenly showing any signs of paralysis or weakness, especially after a potential accident, don't hesitate to seek veterinary attention immediately.
Time is of the essence when it comes to spinal cord injuries.
Absolutely. And even though these injuries can be severe, there's always hope. With proper care support and a lot of love, cats can often make remarkable recoveries.
That's great.
And even in cases where full recovery isn't possible,
right,
there's still so much that can be done to help these cats live happy and fulfilling lives.
What happened to the cats who didn't fully recover? Were they able to have a good quality of life?
That's a really important question, and one that we'll delve into in the final part of our deep dive.
Okay.
We'll explore what long-term management looks like for cats with these types of injuries and what the future holds for feline patients facing these challenges.
Welcome back to the final part of our deep dive into feline traumatic atlantoaxial hyperflexion.
Yeah.
So we've covered a lot of ground.
We have.
We've talked about how these injuries happen, the challenges of diagnosing them,
right,
the different treatment approaches.
Yep.
But I'm really curious about the cats who didn't fully recover.
Yeah.
What does long-term management look like for them?
Well, it's important to remember that even if a cat doesn't regain full mobility, that doesn't necessarily mean they can't have a good quality of life.
So what are some of the things that can be done to help these cats live comfortably and happily?
Well, physical therapy continues to be really important, even in the long term.
Right.
It helps to maintain muscle mass, prevent joint stiffness, improve circulation, all of which contribute to their overall well-being.
So even though these cats may not be walking perfectly, physical therapy helps them stay as mobile and comfortable as possible.
Exactly. And there are also a number of assistive devices available.
Like what?
Things like wheelchairs or harnesses. That can help cats with mobility impairments get around and, enjoy some independence.
I've seen videos of cats in wheelchairs zooming around. It's pretty amazing.
It is. They're so adaptable.
Yeah.
But beyond the physical aspects, there's also, the emotional well-being of the cat to consider. Cats with these types of injuries might need extra attention and TLC from their owners.
So things like providing a stimulating environment, engaging in gentle play, offering plenty of love and affection.
Exactly. And it's also important to make sure their environment is safe.
Right.
And accessible. You might need to adjust things like litter box placement. Food and water bowls. Even furniture to accommodate their limitations.
It sounds like managing a cat with this type of injury requires a lot of dedication and commitment from the owner.
It definitely does. But the rewards can be immense. Seeing a cat who was once paralyzed enjoying life to the fullest is incredibly heartwarming.
That's wonderful. So as we wrap up this deep dive, what are some of the key takeaways that you hope our listeners will remember?
I think the biggest takeaway is just the importance of early recognition and intervention. If you see your cat suddenly exhibiting any signs of paralysis or weakness, especially after a potential accident, don't hesitate to seek veterinary attention immediately.
Time is of the essence when it comes to spinal cord injuries.
Absolutely. And even though these injuries can be severe, there's always hope with proper care support and a lot of love. Cats can often make remarkable recoveries.
That's great.
And even in cases where full recovery isn't possible, there's still so much that can be done to help these cats live happy and fulfilling lives.
It's really inspiring to see how resilient cats can be, and it's a real testament to the dedication of veterinary professionals. Who are constantly working to improve the lives of these amazing creatures.
I couldn't agree more from Vet Neurojar. Keep those minds, inspired hearts light and tails wagging.